Wonderful. And now it's my distinct pleasure to introduce our keynote speaker tonight. You all know him, Michel Moawad, as you make your way to the stage. Michel is the founding member and current executive director of the Renee Moawad Foundation, Lebanon. He's the implementing partner as well as the honorary chair of the Renee Moawad Foundation USA. He's also an elected Lebanese politician, the member of the Lebanese parliament serving a second term, and founder and president of Independence Movement, a sovereignist, reformist, secular, and social liberal political party in Lebanon. Please, everyone, join me in welcoming Michel Moawad.
Good evening, everyone. Excellencies, ladies and gentlemen, dear family and friends of the Renee Moawad Foundation. We are gathering tonight, united, in what has become a yearly landmark in Miami, with one objective: to support Lebanon. The Renee Moawad Foundation, RMF, is not the goal. It is the path. RMF is proudly a professional, transparent platform spread all over Lebanon, built to help you better help your homeland Lebanon and our people, the Lebanese people, with a clear mission: preserving hope and keeping the Lebanese rooted on their land. RMF, of course, cannot do that alone. Nothing can replace a truly sovereign, modern, and non-corrupt state and a productive economy. This is and will stay our main battle, and I can say confidently today, on the 50th anniversary of our devastating civil war, with more confidence than ever, we can prevail. Yes, we can prevail. But this time, we must not miss the opportunity. Yes, we can prevail and build a reformed Lebanon that resembles its minds, builders, and visionaries, not its murderers and looters. A Lebanon of freedom, justice, diversity, and peace, not one of war, corruption, and hatred. RMF is tirelessly assuming its responsibility in this national endeavor, working proudly as a trusted partner with the international donor institutions, the INGOs, and you, the diaspora, to break the traditional barriers and give the Lebanese a chance to succeed in Lebanon, just like you have proven all over the world that success is indeed in our DNA when we are given the opportunity. Our goal is not and has never been to subsidize people. We do not want to transform our proud people into beggars. We have made sustainability our enduring motto and method, preferring to teach how to fish rather than giving a fish. This is exactly what we are doing in agriculture, for example, working comprehensively across the value chain, linking the farmers to the local and export markets. Rather than following the traditional approach, this is what we produce, now how do we sell it? We adopted a reverse strategy, identifying the markets where we are competitive first, then determining what is needed, what needs to be planted, and how to manage the logistics according to specific standards and requirements. Since adopting this approach in 2017, we have supported over 10,000 farmers, created more than 9,000 sustainable jobs just in agriculture, and increased exports to new markets sevenfold. Another example, the World Bank chose to partner with RMF to transition the Amman program gradually from direct aid to a more sustainable capacity building model. I'm sure you don't know what the Amman program is. Actually, it's a necessary yet unsustainable loan provided by the World Bank to the Lebanese government, through which 160,000 Lebanese are receiving a monthly cash transfer. So the World Bank loaned the Lebanese government, and through this program, 160,000 Lebanese are receiving monthly paycheck or monthly cash transfers. Unfortunately, that cannot continue. And at the same time, those underprivileged Lebanese have no other income. RMF's role in that new partnership with the World Bank is to train and upgrade the capabilities of these beneficiaries so they start producing sustainable livelihoods. We have launched, under this new partnership, a pilot program involving 2,700 individuals, training them and building their capacities with the objective of scaling the project significantly thereafter. Sustainability is our ethos. However, we also do need, given the gravity of the socio-economic situation, to cater for and support those who are most in need, mainly in healthcare. More than 70% of the Lebanese people are left today, due to the downfall, without any health coverage and simply cannot afford medication or worse, hospitalization. Just to give you a few figures, the government budget before the downfall was of $18 billion yearly budget. It is now at $3.6 billion. And the Ministry of Health has the same downfall. So we're about $150 million for all the Ministry of Health for 4 million Lebanese people. You can imagine what does that mean in terms of coverage. Given the dramatic situation which is affecting lives, RMF has decided to heavily invest itself into a sizable, sustainable, and comprehensive approach to healthcare. But to achieve our goals, we will need you to embrace that vision, and we will need your long-term engagement. Our approach is built on 3 pillars. First, we have partnered with INGOs, mainly today Project Hope and Muslim Aid, to develop an exchange mechanism with hospitals in Lebanon, whereby we offer to hospitals containers up to 20 for the years 2025 and 2026, or for what is left of 2025 and 2026, containers of pharmaceuticals and medical supplies. In return, we are given credit for around 70% of the container's value to support the hospitalization of the most needy. So we're offering partner hospitals pharmaceuticals and medical supplies, and in exchange, those hospitals are going to give us billing credit to support the most needy in their hospitalization. RMF will manage the whole operation through its 7 centers in Lebanon, and our direct cost as RMF, including transport, fees, custom duties, logistics, and management, will be around $500,000 for the 20 containers, so around $25,000 per container. This is what we need your support for. Meanwhile, the value of these containers ranges between $8 to $10 million. So our cost is of $500,000. The value of the containers are of $8 to $10 million, including over $5 million of support to hospitalization. This represents actually more than 10% of the government's budget outside cancer treatment. So the Lebanese Ministry of Health, outside cancer, has a budget of support to hospitalization of around $50 million. RMF's program today will get 10% of that value alone. And as importantly, produces a multiplying effect on your dollar of 15 to 20 times. $500,000 in cost, 8 to 10 million in services, out of which 5 million in terms of support to hospitalization. That is the first pillar. The second pillar involves developing a network of high-quality primary health care centers across Lebanon, including the south. We're going to try Merjayoun, Beirut, the Bekaa, the north, and Akkar. This initiative aligns with the Lebanese state and international community strategy to strengthen primary health care, community services in order to reduce the public hospitalization expenditure by around 30%. So developing primary health care centers around Lebanon will reduce the bill of the government for hospitalization of around 30%. Given the government's limited resources, it is impossible for the state to build and run public centers independently. They will have to partner with NGOs, and therefore that partnership is crucial. We are collaborating, while we are speaking tonight, with Project Hope, an American NGO that is specialized in healthcare, to present this $10 million initiative to international donor institutions in the US and outside the US, with foundations like the King Salman Foundation in Saudi Arabia also, as well as to private foundations. So the 10 million is the money needed to build and equip the 5 centers. Your support, by leveraging your contacts, is not just valuable, it can be transformative to advancing this life-saving initiative. Last but not least, the third pillar focuses on expanding the Medchronic program that you have been supporting since 2023, and that is now ensuring to 4,000 patients every month chronic medication and medical follow-up. Our vision is to transform Medchronic into a comprehensive home care service, an essential yet largely absent component of Lebanon's healthcare system outside the greater Beirut and parts of Mount Lebanon. So this is not only a question of cost to people. The home care service does not exist in rural areas, where really this is not only a need in Lebanon, this is natural in Lebanon, because you all know that elderly people in Lebanon live with their families. So it would be much easier to arrive to their homes. While I was visiting a person that was a beneficiary of the family of a person that was a beneficiary of the Medchronic, that was taking chronic medication and that unfortunately passed away, I went to their home, a small house with clearly very little means, underprivileged people. And while I was sitting, I saw a wheelchair and I saw oxygen machines. And I told them, what are those doing and how did you get them? And the family had the help of their village, but also had to borrow money because the father that passed away was using those machines and that wheelchair for a few months. And because of not having the service, they had to buy all this equipment, and that has cost them $4,000. While if we organize a full-fledged home care service, these machines can be offered or rented for a very low price to people, and therefore saving them a lot of money and giving them the necessary treatments at home. I believe that that is game changer in the rural areas and in the underprivileged areas in Lebanon. This expansion aims to bring vital medical support directly to underprivileged communities. And I am very excited tonight to announce that Dr. Gerard Moawad, who's here with us, and his wife Nada, have committed to $100,000 annually. They said for 3 years, but I didn't hear the 3 years. To pilot this initiative in their hometown of Zgharta. Nada, it has become your hometown. It's not my fault if you married the Moawad. If you had asked me, I would have told you never do that. Allow me, of course, to thank Gerard and Nada, but also to thank all our donors, one on one. And I believe you're not any more donors, you're the René Moawad family, foundation family. You have been a cornerstone, a lifeline to our success. I would like also to thank our leadership in the US, our chairman, Dr. Joe Jabra, our new president, Adib Assis, our executive director, Nadia, our board members, some of them being here, and of course, our Queen of Heart, Rima Otraji, without whom we would have never been gathering tonight in that milestone event in Miami. Thank you, Rima, for everything you're doing. I would like to end by saying that this transformative vision is no longer a distant dream. It is unfolding before us. Yet, its full realization depends on collective action. You're embracing this initiative and this vision. Your support, your networks, and your belief are the catalyst that can transform this vision into lasting reality. Together, we will bring back the hope stolen for us for so many years, from us for so many years. Together, we will keep the Lebanese people rooted in their land in dignity. And thank you.